Okay, so our favourite question to be asked is, that people have come in, they've seen everybody. They've seen their local physio, their doctor, their specialist, their chiropractor, everybody. The first thing we ask, after your treatment, do you feel good for a couple of days? Invariably, most people say yes. They feel good for a couple of days, only for the symptoms that they get to return. Okay, so our issue in terms of asking or answering sort of people as to why what we do is any different. When it comes to lower back pain, what is it that we do that sets us apart? And it's not so much that what we do is so fantastic, with it, it's so radical. It's the sense that we target what's actually that underlying cause. We're all about symptomatic treatment, but not long-term symptomatic treatment for a problem that will never go away if that continues down that path. Okay, so that's what we sort of look at doing. Like in some of the other clips we've said, there's two sides of the coin. There's invariably a weakness that builds up over a long period of time. Normally an innocuous event occurs and that person hurts their back. After them hurting their back goes into spasm. It does that, no different to how when you strain your ankle, all that inflammatory fluid rushes to that area to help to heal the area, but more so to immobilise, to keep it not moving. Okay, it does it as a self-protective mechanism. The back's no different. We spasm to the point where it's extremely painful, but we do that to protect all our intervertebral structures, so we don't do any further damage. Okay, so what happens is, because we become more rigid for a period of time, we get weaker and weaker, and that's where a lot of these chronic conditions start to creep in. So when we're taking these people in, what we start to do is go, right, the two sides of it is the weaknesses are built up over a long period of time, also the tension. So our SCT release, we work all throughout the body to eradicate all the tension in their fascial trains, their connective tissue, their muscle tissue, but then we start looking at exercises that train, that stretch all of your tight muscles and strengthen all your weak ones, that are targeted upon reconnecting neural pathways and restoring that person back to a state where their own human movement will self-perpetuate their own healing process.